All right, let's get started. Welcome, everybody. Happy Friday afternoon if you're here on the East Coast, still the afternoon if you're on the West Coast, and if you're in the middle of the country, you're doing great. Welcome to our 40 Under 40 in Public Health Career Panel brought to you by ASPPH and the Beaumont. We are so excited to have a panel today with our class of 2021 40 Under 40 honorees. They have some great information about their career trajectory, what they did when they were in schools and programs of public health. So we're really excited to dig into this conversation. I want to thank the Association of Schools and Programs of Public Health for holding a series of webinars for National Public Health Week. And we are rounding it out with a great conversation this afternoon. And so just a reminder, today's webinar is being recorded. It will be posted on the event link website after. But if you have any questions during today's webinar or session, please feel free to write them in the Q&A area. We will have a 15-minute approximately Q&A session at the end of today's webinar. So let's jump into it here. I am your moderator, Cassandra Allen. I'm a senior program associate with the Beaumont Foundation. And it is a pleasure to have the class of 2021 40 Under 40 honorees here today, which I will let them introduce themselves. They are phenomenal leaders in public health. And I'm saying that I got to meet some of them a couple weeks ago. I have some lessons to learn, and I know you all do too. So I'll pass it over to Jenica Allen. We're just namesakes today, but I'll pass it over to her to introduce herself.
Thank you, Cassandra. Hi, everyone. My name is Jenica Allen. I work at the Massachusetts Department of Public Health, and I'm about 27 days shy of 10 years. And I am currently a manager of community engagement practices in our Bureau of Community Health and Prevention.
And Dr. Travis.
Hi, good afternoon, everyone. I'm Alexis Travis. I'm the Assistant Provost and Executive Director for University Health and Wellbeing at Michigan State University.
On to you, Ryan.
Thanks, Cassandra. Hi, everyone. I'm Ryan Azridad. I am the Belonging, Diversity, and Equity and Inclusion Health Equity Manager at the Children's Hospital of Orange County. I'm actually assuming my role starting next week, so it's a pretty exciting opportunity.
And rounding out our panel today, we have Jamie.
Hi, everyone. My name is Jamie Schaff, and I'm currently leading a Robert Wood Johnson Foundation Pioneering Ideas project on mental health for Johns Hopkins University. You're muted.
Just a reminder, if you have questions, put them in the chat. Thank you all for introducing yourselves. I caught the mute. So to get us started, often when people are choosing to decide to get into a program of public health, whether it be undergraduate or graduate, we are often faced with the question of what is that? What does that mean? So how do you all explain the field of public health to people that are unfamiliar with it and those who often fall as family and friends?
I'm happy to start with that. So if you give me enough time and leeway, I will tell you everything is public health. But I think that the way I sort of conceive of it for myself is this idea that we are focused on populations, we are focused on communities, we are focused on systems and structures, and how all of those things come together, interact, and intersect to create facilitators and barriers to folks being well and being healthy and enjoying all of those things that we want for ourselves and our families.
And I agree with that definition, Jenica, as well. And I would just add on to that, it's a science, right? And we do the science of protecting and promoting health while preventing disease, and very much looking at population and community level, as you mentioned. But also it's kind of a broad mixed bucket of things. And, you know, when we say public health is in everything, that is true. It's in the environment, it's in the food that we eat, it's in, you know, tracking of disease and outbreaks. Many people have become familiar with public health during the COVID-19 pandemic. Prior to that, I would mention public health and it would be a blank stare. Now, since COVID, a lot of people know kind of the disease outbreak management that we do. But that's not all it is. It's, you know, access to physical spaces for physical activity, making sure people have access to healthy food, and then also the knowledge, the skills, and education to be able to make the healthful choice in the easiest way. And I guess the last thing I would say on this, you know, I was previously a state public health director in Michigan, and I think each state defines public health differently depending on what's in their bucket and purview. And I think that is similar when you look at like the local community level, and then of course at the federal level as well. So just wanted to add that.
Jamie, Ryan, anything you would like to add?
Yeah, just to build from all of this, you know, everything is public health. And by everything, I mean everything. Like every person, every job, every industry has a role in public health. And hopefully, as we talk today, everyone will see how beneficial multidisciplinary teams that work across systems, across environments, across sectors can really contribute to innovative, powerful public health solutions.
Yeah, I think everyone has mentioned kind of the gist of like what public health is. And so I think looking at public health, I think it's an opportunity to look at just like, you know, like population health. I think one thing about public health is like we're all kind of like population and community health like strategists. We're all there here to improve the health and well-being of the people that we interact with, people that, you know, who kind of touch our lives. But doing it, looking at improving not only just like physical health, but also emotional, like social, like spiritual. And so it, again, as everyone has mentioned, public health is more than just like a one, like short, narrow definition. It can encompass all the work that we do and all the different things that we want to do for our populations and communities.
Absolutely. Thank you all for sharing that. And very similarly, public health, as we all know, it has so many definitions. It captures and encapsulates so many things, but a career can be just that as well. There is no straight line. There is no specific trajectory. Your job title now may not allude to exactly all of your expertise. So with that, what area of public health did you decide to get into, whether it was when you were choosing your MPH concentration, if you had one, or even just deciding what got you really involved? Or even just speaking to how did you even go about choosing a concentration, even though it may not be exactly what you're working in now? And so I'll actually go to Ryan to start us off this time around.
Thanks for that. I don't have a Master of Public Health. I actually have a Master of Public Policy. And so I wouldn't necessarily say I'm like the odd one out, but I do feel that the fields of like public health and public policy, possibly even urban planning, they're all very interconnected because they're about improving systems and policies, and just to make sure that everyone, you know, it's like working according to how we want it to be. And so I think for me, when I actually went to my master's program in public policy, it's because I wanted to apply for University of California, Riverside's School of Public Policy to be part of the first ever cohort. And so, you know, I think the way that it just happened to shake out was it was an opportunity for me to, you know, pursue public policy, but through kind of like a health policy, public health lens. And so, even though the program didn't have a specific health policy component, I was able to like do work and research to supplement and complement my public policy skills. And so, and during my time at UCR, I was actually doing research, qualitative research in food insecurity among like students. And so I was actually a principal investigator for kind of like a food security research that I was able to apply for through the University of California Office of the President. And so I think for me, for those who are kind of like leaning towards like, you know, what master's program they're looking into, I think it's definitely looking at you know, where they see themselves, because I feel like my career in public health, even though it's very policy focused, I've had the opportunity to work at nonprofits. I was recently at County of Riverside and the County of Orange's public health departments, and so I feel like even though my training was in public policy, I was still able to leverage it towards the field of public health. And so I definitely encourage folks to look beyond just an MPH and see what other opportunities are out there in terms of their master's studies.
And Ryan, I want to thank you so much for highlighting that. To Dr. Travis's point earlier, we're seeing that it's so important to make sure we're putting public health in policies to make sure they're not unraveled by, unfortunately, the cycles of government and other policies that can be on a state-by-state basis, and that we definitely see within public health to ensure that what we're putting forward stands for generations and not just one moment in time when we hold positions. Who else would like to share what concentration they chose?
I can go next. You know, I'm kind of probably the opposite of Ryan. So I have a PhD in public health and specialize in community health education and promotion. I will say my, primary field of discipline was pharmacy. So I have a master's in pharmacy from the UK. I had done a lot of work in community pharmacies, and so really got familiar with what community health looks like when a patient is presenting in a pharmacy. And, you know, their complaint could be just about anything. It could be something really serious to, oh, I got, you know, a bug bite and can I have a cream to put on it to ease an itch, right? And so but more overly, I think when it comes to the aspects of community health that I love, it was really about being able to work in lockstep with communities to really listen, hear what the problems are, and work together to find solutions to the issues impacting health and well-being. And the other thing I really love about community health and why I chose this discipline was because it's an opportunity to work across sectors and across discipline and to leverage various different types of resources to achieve the best for community health. So I've just found it really interesting and fulfilling as a field of practice.
Amy?
So mine is a little bit of a blend of both of these. So you know, I'm one of those overeducated geriatric millennials. I have my first master's in public administration, and I used that to go into humanitarian aid work. I had wanted to work for Doctors Without Borders since I was a kid and heard about Rwanda, and I got myself there through public administration. I'm so grateful to have had a career in administration because it gave me incredible experience doing financial management, human resource management, program management, you know, working on huge projects, small projects, all sorts of things, grants writing, etc. After one of my last really long-term assignments in the field, I decided to go back to school to get my MPH in epidemiology. And I specifically wanted to study psychiatric epidemiology because I felt that that was a huge gap in humanitarian aid work. I then had my own personal health issues and moved to domestic public health work so that I could stay here. And I think that's really important, that we're all human. Something that I love about my current DRPH cohort, so I'm in a doctor of public health program at Hopkins right now, is that we all are real. We're all living real life. We all have real life challenges, and we all incorporate that into our public health journey. And that's something that you'll all experience as you go through your life and your careers. And I think it's also really important to know that every experience you have had can bring something to public health. I see resumes all the time where people have minimized prior experience that they felt wasn't relevant. And I talk to them and I'm like, you've done graphic design for 5 years. Let's bring you into data visualization. Let's incorporate that into our statistical modeling, like all sorts of stuff. So, you know, I think that it's, you can have a really rich, interesting career, and you can always go back to school and change things up.
Thanks for sharing.
I did my master's of public health many moons ago, and I chose social and behavioral sciences as my concentration because my focus was the opposite of all of those things, right? I ran in the opposite direction of research and epi and all of those pieces, and I think that those are wonderful, and all the researchers and epis I work with are amazing people whose brains I don't understand. So for me, it was about picking a concentration that allowed me to focus on structures and systems and a little bit more systemically, not necessarily that those concentrations or pursuits don't, but I was specifically seeking out something that allowed for the intentionality around that.
Absolutely. And I kind of want to dig into a little bit what Jamie was mentioning around the fact that there are so many things that within our lives you don't even realize is a skill that you can apply to things. So throughout your programs, throughout your careers, what activities have you found outside of the classroom, outside of your programs that you participated in that you found really enhanced your experience and your success in the field thus far?
I can start. So I am a racial justice facilitator, and to me that and public health are one and the same. And it is not necessarily something that is in my job description or was part of my schooling, but I think that it has only enhanced my public health practice to be able to make those connections and draw those really, what for me feel really clear links between justice and equity and public health. So, I facilitate internal to my organization, externally to my organization, from my organization as often as I can. And I think that all of it sort of enhances my general public health practice.
For me, it's
And
pretty
Sharon.
varied. Sorry. So with humanitarian aid work, I learned so many things, and one thing is to never discount the wisdom of communities. Coming back to the United States, I think that's something that we're starting to incorporate into our routine practice a little bit more, but it's not necessarily something that is standard. So definitely, and I've really loved seeing people coming out of their education programs more recently with already knowing that that's really important, and that's really, really fantastic. I think I've spent a lot of time working with students and mentoring early career professionals, talking to people about very different career paths and, people who want to do things that I don't know anything about, connecting them with folks that I know who've done that. Out here right now, I'm in Colorado, and I'm really involved in the outdoor community. And I'm a big reader. I read The Overstory a few years ago, and it was kind of life-changing. But out here, it's a huge push to address climate change and also to diversify the outdoors. The outdoor space is not very diverse. And so increasing equity, diversity, and inclusion initiatives to bring people into the outdoors, similar to STEM, is really, really important. And I think that having a work-life balance and making sure that we are valuing our own health and wellness is really important in this field.
Just share a couple of experiences along the way that I think have enriched my understanding of various sectors, and then helped me to bring that lens back into my public health practice. So one of the early things that I did was becoming a volunteer crisis counselor, first in the UK at Childline UK, which is crisis counseling for children. But then when I came to the US, it was also crisis counseling for adults as well. And that's been really helpful to just apply a trauma-informed lens when thinking about mental health and how we approach even, our programming from a trauma-informed way in public health. I also served on many different nonprofit boards of directors, one being American Red Cross, which was really helpful in understanding emergency preparedness, and then bringing that back to apply with actually when I worked with the Bureau of EMS Trauma and Preparedness as public health director, but then also worked with on a nonprofit board for a public charter school. And that was helpful, and kind of learning also how health centers work within school settings, and just learning about that side of health in school as applied as an administrator and policy making. Serving with community foundations as well has been really helpful. And then I've had roles like part-time jobs while studying that have just been really helpful in kind of either exposing me to different populations that I hadn't worked as much with before. So I worked on an NIH-funded study on macular degeneration and was a clinical trials manager, so recruiting older adults into the study. And through that, I learned about kind of engagement with older adults and how meaningful a conversation is to them in their day sometimes, especially in light of social isolation and that being more prevalent in older adult populations. And so that's been helpful as well. So yeah, I think, opportunities to work with nonprofits, being willing to do volunteer work, especially if it's going to bring you into contact with populations or different skill sets that you didn't have before.
So for me, my area of interest in public health is kind of improving the built environment. One thing that I'm very interested in is the intersection of public health and urban planning and how to create just healthier communities. And so I'm currently a steering committee of Planners for Health, which is an initiative by the California American Planning Association, just to connect those who are public health professionals with urban planners and to see how these two different fields can come together just to create more healthy, vibrant, equitable communities. I think, in the field of public health and urban planning in the early days used to be very kind of in line and in tandem, but unfortunately there has been this kind of like this schism between the two. And so I think for me, my passion of built environment improvement definitely kind of informs my work in public health, especially through the lens of like health equity and kind of health equity and racial equity, because I feel that within public health, you can't talk about public health unless you talk about kind of like racism, like trauma, like generational trauma that many different communities of color have endured. And so I think there's definitely an opportunity to not only look at improving the community, but also, as Dr. Chavez mentioned, kind of looking at like trauma-informed care of public health. And so I feel that kind of like being able to look at what is relevant to public health, to urban planning, to policy, I think is definitely helpful if, as public health professionals, we're able to look at work in terms of systems change and systems improvement.
Thank you all for sharing that. It just really shows how many vast opportunities there are and how they all, once again, everything is public health. So they all apply in some way, shape, or form. So I want to take a second, and in the present, you all are class of 2021 40 under 40 honorees. At some point during the application process, before the application process, you reflected on yourself, you reflected on your opportunities, you reflected on what you did and said, you know what? I believe I'm a leader in public health, and you're recognized as such because you're doing such phenomenal work. But I want to take a second and pull back and go back to when you all were applying to the PhD programs and the DRPH programs and the MPPs and the MPHs and all the degrees under the sun, because you all are extremely qualified. But if you could give any advice to yourself when you were applying for those programs, what would that piece of advice be? And what would it be to other students who are applying right now? We can start off with Jenica, why not?
Thanks, Cassandra. So I think in terms of my MPH program, the advice that I give everyone, so I'll often go back and talk to community health students at my undergrad or different folks who are considering grad school. And I think that one of the most important things to think about in grad school is, one, that it's not worth the time and the money and the energy if you're not certain, right? I feel like college is that time when you're sort of feeling things out and trying different things. And then grad school is just too expensive in terms of like money and personal spirit to not be certain. So I want to start with that, right? So I went into grad school very certain that I wanted to come out with an MPH. And I think that after I got through the program, the advice that I like to offer folks is that the thing that brings you to grad school, that brings you to your degree program, that brings you to whatever your sort of schooling choices and programs look like, is not going to be what brought everybody else. So I think it is really important that you stand firm in your own understanding of why you're doing what you're doing, and certainly remain open to what other folks are thinking and where they want to focus. But it can be really hard, and it felt challenging for me to show up in space and be like, well, this is the ultimate thing, and this is why I'm here, and this is really important to me, and it didn't necessarily make anybody else's top 10, right? So I think that understanding and being able to really hold firm in your own reason and your own why will get you through your program when you find that you're not able to identify the same reasons and motivations in your fellow students.
Really good advice. I'm just actually like, it's resonating a lot with me. So I think it's okay to admit in this space if we feel like we would have done things differently. And so I'm going to say, if I had to do things again, I would have probably, I mentioned earlier, I have a PhD in public health. I would have probably done a DRPH. And the reason for that is because it's more of a practice-based degree. And up until about 5 months ago, I had never worked in an academic institution. So the research-based degree that I had wasn't as helpful to me. I do think, you know, in terms of being a public health practitioner, the DRPH allows you to get that applied experience and do more project-based work throughout your degree, as opposed to the more theoretical or research-based work that is acquired from doing a PhD. So that was just a takeaway for me. I would say, though, in the last 5 months, I am glad that I have the PhD, you know, as well. Being in the academic arena, I think it's highly valued. But in terms of the actual work that I do, I don't teach at the moment. In the future, I may, and it will be helpful to me at that point. Yeah, for right now, I'm a public health practitioner, and I don't teach. So.
Brian?
Yeah, I think in terms of like that, that's what folks have mentioned. I think it's definitely important to, I know for me, I'm currently in the process, I'm currently on hiatus for my DRPH program. And so at some point I do want to eventually go back and continue it. I think for me, the reason why I wanted to do a DRPH was because of kind of like a practice-based approach, because I have had opportunities to work in, you know, like various like sectors of public health. And so I do definitely want to kind of gain more skills. Part of it too, I think the field of public health is very, I don't know, it's very credentials heavy, where unfortunately there's this mindset of unless you have all these letters after your name, it's hard to be taken like seriously, or, you know, taken like one's perspective is kind of like legitimate. And so I think it's important for us as emerging leaders in public health to also know that there is a value in community-based knowledge, and that community leaders in themselves are leaders in their own right. And just because they don't have, maybe they don't have the public health training or knowledge. And so I think it's, yeah, I think for me, in terms of what I'm trying to seek out, I think it's something where it's helping more of community members and doing more community-based participatory research, and to ensure that community voices are heard and they're recognized.
I definitely co-sign everything that was just said. I think it's really important to think about what it is that you want to learn and get out of a master's program. And that could inform the type of program that you go into or the specialty that you choose. If your plan is to work on, you know, a practicum or a thesis or a dissertation or anything, really think about who you want to work with. Is there a professor that you really admire? Is there a practitioner in the field that is taking on students at a university? I think having a good advisor is so important. And I've been very, very fortunate in my graduate education to have had just incredible academic advisors. And I've worked with people who are doing just incredible work and who are very supportive of me and what I want to do, which is maybe a little bit different from other students. And I think that it's also really important to think about the finances. Graduate school can be very expensive. DRPH programs, I love the DRPH program, but it is hard to get funding for DRPH programs at the moment. And it's also hard to find funding for your research. And that's a big factor, I think, for everybody. One of the benefits of a DRPH program is that you're typically working. Not all programs can be done hybrid or remote, but many of them can be. And so you can work at the same time. And the flexibility of that is incredible. So you can go on pause, you can take a leave of absence, you can take one course at a time. You can really go at your own pace, and that is really beneficial. And many folks are able to also go at the pace that they're able to financially afford, which is a really critical factor. I think that it's also important to know that, you know, many of the diversity, equity, and inclusion initiatives are inclusive of taking down educational credentials as a mandatory minimum requirement and valuing lived experience as equal or better than educational experience. So if you're a person who has a tremendous amount of lived experience, find a way to put that on your resume and to make that speak to us, because, you know, as people who are hiring other people, we really, really do value lived experience.
I want to take the time to say I really appreciate you all being so transparent about the journey that is school, the journey that is these programs, right? Sometimes you need to take a break. And Ryan, thank you for sharing that. Sometimes you look back on the degree that you got and you're like, this is not fully what I wanted to do, but it's going to work and we'll make it happen, right? And then also the fact that no field or industry is perfect, and that sometimes having a ton of credentials is what gets us in the door, but how do we make sure that's not the only way that public health is, right? You shouldn't have to have all these letters and alphabet soup behind your name to really create change in this world. And so I want to dig in a little bit here about something we all care about, right? Getting a competitive job. How do we make sure we're making sure we're qualified, doing the right steps? And I want to add a little extra layer to this. When a lot of us are in these programs, it's often not just school and only school. People are working, people are holding multiple internships, loans are real, right? And sometimes those opportunities are within public health, or sometimes they're outside of it. So one, how do you get a competitive job in the public health field? But two, if you had to work through your program and it wasn't directly related to public health, how did you use those skills that you gained to make sure you were still a competitive candidate for a public health opportunity? And I will give it to whomever feels like they want to start. I know it's a very big and loaded question, right? Because competitive can mean a lot of things to a lot of people. Is it salary? Is it benefits? Is it institution? So I'll give it to whomever to start us off.
And start us off. So I think there's lots to being prepared to get the right and competitive job for you, right? So we've talked about the academic preparation, which is one piece of it. But also, like, along that process, I have found it has been really beneficial to have a mentor and somebody who can help to navigate all of the processes and also some of the relationships in order to, you know, be able to be even considered for the right job. Because in the world that we operate in, a lot of the decisions about hiring, and it shouldn't be this way, but sometimes decisions about hiring are even made on the basis of who knows who, or, you know, just even being aware that there's an opportunity coming. So that's been really helpful for me. The second thing is being intentional. So picking the right thing in the first place. So we've talked about, you know, making sure that the position is competitive and that you're being valued for the work that you're going to be doing. You know, loans are a real thing, but also making sure you're picking a role that is going to be fulfilling to you in a deep and meaningful way, because we all know that public health workers are often, you know, many times underpaid for the work that we do. So finding the right thing that you're passionate about, and where there is going to be not only an opportunity for today, but the opportunity for you to grow and progress in alignment with your vision for your own career. Another thing is getting experience early. So I talked about some of the experiences that I had either throughout my master's program or even through the PhD program, like not waiting until you graduate. Public health is such a competitive field. I know that earlier folks have mentioned, you know, having different types of degrees and working in public health. And then we've talked about having public health degree and being willing to branch out and going to other areas. Well, in both of those scenarios, that increases the amount of competition that you're up against. So you've got to be able to think early how and what other experiences are you bringing to the table that's going to, you know, differentiate you from somebody else who might be applying for the same job. And then the last thing I would say, and probably more practically, is in the process of searching for the right opportunity, is focusing your efforts and energy and applying carefully and tailoring applications to the job and being prepared for the interview. Because I think, you know, I sit on the other side of the table hiring a lot of people at the moment, and it really makes a difference. Those folks who have looked up and understand the mission and vision of the organization that they're hoping to go and work for one day, and have done a little bit of homework, and that actually there's great alignment between personal values and experience and things that you can bring to the position. So those are just a few things that I would say have helped.
If we could go to Jenica, I know you all have some experience in governmental public health, but as someone currently there, tell us a little bit, some advice that you have.
Sure. So I have been at my job, like I said, I'm 20 something days shy of 10 years. And to catch on to what Alexis was talking about in the practical piece, I think that write a cover letter, right? We cannot make, as I sit on a ton of hiring committees too, not even as the boss, but we hire, we interview, I should say, by panel at my job. So you're always going to be in a room with at least 3 people across from you. So I would say do a cover letter and make it clear that it is about the job that you are applying for, right? I think we see a number of cover letters that are fairly generic. Here are the things and here are the classes I took, and that is all really great. But what we are looking for, because we might get a state job is great, right? It's an important thing, and it is, you feel like you can get in there and really start to work in the system. And it has great benefits and all of those things. So we might get 200 applications for a position. So we need to know why this one and why you. So I think a cover letter is really important. We're not policing language. We're not checking for spelling and grammar and those things. What we want to know is why this role for you. So I would say that for sure. And again, we can't make those connections. If you're coming from something completely outside of the traditional, whatever that looks like, path in public health, but this is really a job that you want, we just want to know why, right? Like we can't infer those connections. So I would invite folks to make them for us. And then the other thing that I did when I was applying around, and I'm sure that everybody can relate, but when you're applying, it feels like a job in and of itself, right? And nobody's paying you for it. You get no time off, and it's a nightmare. So one of the things that I did, super rudimentary, but incredibly helpful, was I had a legal pad where I wrote down the date that I applied, if applicable, the date that the job closed, the salary range, some like really high level basic key functions, who I would expect to hear from, all of those sorts of things, so that when you send out 10 cover letters and resumes in a day, and then in 3 weeks you hear back from 3 of them, you're not like, which one was that? So I think that those are just some really practical but incredibly helpful things that I have found as both a person seeking employment and a person seeking employees.
Just to add to that, if you're able to figure out what the timeline is for hiring, try to fill that in. Be prepared for like a 9-month timeline. That's actually pretty standard. If there's a change in administration for government, if there is anything political happening, if there's a budget thing going on, expect that timeline to change. So think about that and build that timeline into your planning, because I mean, not many people can go 9 months without working. So just plan to have, some way to make an income while you're working on the applications. Similar to Jenica, I kept an Excel spreadsheet and would just fill that in. And I think it's really important to stay organized and don't send Word docs, send PDFs. I think that is really, really, really important. If you're applying to government, oftentimes there are minimum criteria. And even though I said before, we're trying to get rid of the minimum criteria, oftentimes we are legally obligated to have those minimum criteria still. So if those are listed, make sure that you meet them and that you are putting them very clearly in your application and you're not just skipping over it, because the system could actually screen you out if you don't fill in all of those sections.
Yeah, I definitely echo what everyone has mentioned. Also, when you're doing your job applications, I think like definitely use like LinkedIn too, because I know for me, I've used LinkedIn as kind of like the I don't know, like the depot where I put all my experience. And so like if someone wants to look at kind of like further information about what I've done, my LinkedIn can definitely be that repository of like my experience and kind of like skills and certifications. And so I think it's definitely important to have that presence, also kind of like that social media presence, like online, about like who you are and what you're interested in and what you're about. Because I think nowadays, as we're going through hiring for various like staffing, I think we want to know that the person is capable of doing what needs to be done, but also has a certain like authenticity and about why they're passionate about what they're doing. And so I think for, whenever I've had to apply for various jobs, I've always put in kind of like kind of like who I am, how I stand out, and then kind of like go into like what my experience is, because I think, as everyone has already mentioned, there's a deluge of applications that happen. And so just like, how do we kind of like screen through the noise and kind of like get to the core of the folks who think will be best suited? And so yeah, I think it's very important to and kind of be organized. I think for me, I've kept a track of all the different positions I've applied for. I have like in my shared drive, I have a folder of all the various positions I've applied for. My cover letter, I think it just goes through iteration of like how to, like tailor fit. And so yeah, always be organized, have kind of a good archiving system of, the various positions you apply for, the various fellowships, leadership opportunities you apply for. Because I think over time, we all kind of construct our own kind of public health narrative of who we are as public health professionals. And I think as we get seasoned further down the line, we're able to like kind of do that narration and storytelling of who we are and how we fit into public health. And so yeah, definitely hone in on who you are and like what you're passionate about.
And I think that's a great segue into my next question. I just want to give a reminder here, if you have questions, put them in the Q&A. As you can see, our panelists are on top of answering these questions, so get them in the chat, in the Q&A area. But I want to ask you all, during college, in school, in programs, it's really easy to know who's the leader, right? Who's leading the group project? Are you president of this organization? Oh, like you fall in this area, right? It gets very clear, it's pretty defined when you're in these programs. But then you start working, right? And your automatic position out of school is not director of such and such. Maybe it is, and if you are, you're amazing. Please come talk to me. I want to know how you did it. But how do you find out or even know you're a leader? How do you build a path to leadership when you're outside of the system of school where it's very clear, oh, that's how you know when someone's a leader? How do you do that in your work, in your career, define your own leadership? And then how have you used that to really find the joy in your work? Because being a leader can be a lot. It can be so much. It can be the burden of responsibility. It can be the fact that you're a leader in a field or a topic that doesn't often want to be talked about. So I just want to ask you all, right? In the ambiguity that is a career, how do you know you're a leader in it? And then what do you enjoy about your work that continues to push your leadership and your ability to continue to be at the forefront of public health?
I think in terms of being a leader, I think it's always knowing always be in the path of self-improvement and self-reflection. I think a good leader is someone who knows how to have like that, like those like people skills of like, knowing how to connect with someone. Because I think at the end of the day, like leadership is being able to connect with someone and getting them passionate about the same things that you're doing. And so I think in terms of leadership, like feel free to always like seek out leadership opportunities. For me, outside of 40 under 40, I'm also part of the diverse executives leading in public health through ASTO, the Association for State and Territorial Health Officials. Because I think as we're all like leaders in various parts of our journey, I think it's always important to have those cohort, those cadre that you can kind of lean on and know that these are the same folks, the same folks you see right now will be the same folks that you will be kind of like in the trenches, the public health trenches with you further down the line. And so I think it's important to always like seek out those opportunities. And I know our panelists mentioned having mentors. I think it's also important to have those mentors who have already laid the path for many of us, for all of us. And so it's important to know that the work that we're doing is built on the shoulders of giants. And so just being open to improvement, being open to wherever the public health journey takes you. I know for me, it's been a very not like a straightforward path. I've had the opportunity to do various work that have definitely strengthened my knowledge and perspective as a public health professional. So I think it's important to know that sometimes like the universe will take you a certain way that where you may not see yourself, but can just lean into it, and everything will always turn out for the best.
So you are already a leader. Everyone is a leader, and it doesn't really matter what your job title is, what your role is, where you are on the org chart. You are a leader. And I think that's a really important thing to think about, is that, okay, you as a leader now, no matter where you are, who do you want to be as a leader today? What gives you integrity? What are your boundaries? What are your morals? What are you willing to do? What are you willing to compromise on? What are you not? It's really, really, really important to know yourself, and to know that at the end of the day, you have to live with the choices that you make. You have to live with the decisions you've made. You have to live with the way that you've interacted in the world. I think that one of the things that we heard in our DRPH program, like week 1, be a good group member. I think we've all been on these group projects where you end up doing all the work. Don't be that person. Be a good group member. My DRPH program, this is the first time I have not been on a group project without great group members. Every single person leads in their own way, and we all support one another. So I think that's a really important thing, and that's really, really, really important in public health right now. Where, as everybody knows, the public health workforce is in crisis. Our mental health is not great, and we really need to be there to support one another, to help us through, and to really encourage a new generation of public health leaders to, go to school, get the lived experience, bring that experience to public health, and make a really big difference.
Yeah, I really like that you said don't be that person. I would agree with both of the earlier comments by both Ryan and Jamie. I want to say that everybody has the capacity or capability to be a leader. And I think some people lean in more to leadership and some people are not as comfortable with leadership, but we all have an ability to make an impact and make meaningful contributions to the work. I do think as leaders, we have to take care that we know what the true north is in any situation, especially as public health professionals, because of the impact that our work has. So I always try to think about, on a daily basis, can I be proud of the work that I did today? Can our team be proud of the work that we did today? And then if you think about 5 years in the future and you look back at some of the decisions you made or some of the things that you did, would you be proud of those actions? And I think those are really kind of good and interesting questions to ask yourself as you kind of go about your work, to keep that in mind. The other thing is, I think, and I agree, that it's not about a position or a title. In fact, a lot of the times, especially in the work that we do in public health and in my chosen field of community health, it's about shared decision making, sharing power, really trying to address disparities. And the only way you can do that is by working really closely with community members and with people who are sitting at all different levels and from all different backgrounds, and being able to have a one-to-one vote between people who hold power in terms of position and then people who hold knowledge, expertise, and have lived experience. And so I think there's different ways of seeing that leadership role, but all are equally important and valued, and we need to be more inclusive and expansive in our definition of leadership.
And if I can just add quickly, so for me, I think it's, I've tried to do my best to build a foundation for myself that consists of things like commitment, right? So returning to that idea of being certain of my why and my motivations. I really, really value being prepared, right? Like I will write a script if I need to, but I need to be ready for what's coming. And I think tied to that is the idea of having a knowledge base and having an openness to learning and something to sort of stand on. And, so I think that knowledge and that preparation are really connected. And for me, I've had mentors professionally who have seen to it that I sort of lean in, as you said, Ryan, to any roles. But I think that one thing that is really important to note is particularly, so I identify as a Black woman, and I think the internalized racism, the internalized patriarchy says every time that I get something in a leadership space, oh, they're taking a chance on me. Oh, did I really earn this? Right. So all of that starts to show up. So that is when I need to be able to turn to my foundation that I've built of my commitment and my preparation and my mentors and my knowledge and learning to say, you know what? Yeah, I did actually earn this. And like, they're not taking a chance on me. Right. This is because all of these things that I've spent so much time committing to. So I think the advice sort of tied up in that is people probably won't actually be carving out a space for you in leadership, regardless of who you are and what your background looks like. So you just have to build something that allows you to carve it out for yourself.
Thank you all for sharing that. And I think there's so much that resonates across the board. And I do want to take one question from the audience, which I think ties into this a bit. There's so many conferences that happen in public health. There's APHA, there's SOPI, there's so many things, right? And often when you're attending these things and you may not have the alphabet soup yet, or you just don't feel so sure of yourself, it's difficult being in a sea of people who are advanced practitioners in public health. So what advice would you give to someone going to these conferences, how to connect with other professionals, or just how to navigate a conference in general? And we'll take a couple of answers. Ryan, I did notice you answered that. So if that's okay, we'll either go to Dr. Travis, Jenica, or Jamie. Feel free to give an answer here.
Advice for attending conferences. So yeah, I mean, go to them as much as possible as you can get funded to go for them. I think, it's a great opportunity to connect with other professionals in the field. We used to take a lot of business cards. Now people don't do that as much, but however you get connected. I know Ryan mentioned LinkedIn. I'm a big LinkedIn fan as well. Try and connect with people there and then go to the sessions, but also bring the information back to your team. So one thing I really love to do is have people present back on, key takeaways, or even share resources, like pick up extra copies to bring back to your team. And that way you're being a good team member and you're helping other people to learn at the same time. So that's just a couple of things that I would say about conference going.
Would anyone else like to add?
I will add something that sounds trivial, but it's not as trivial as it sounds. Wear a statement piece, right? Like when you go someplace, because I will tell you, my shoe game is unmatched and unrivaled. I promise you that. So when I go to conferences, that's like a thing that I do, right? I will always have a fun shoe on and people will comment on them and then you've opened the door. So like for real, a statement piece, a weird hat, a funny hat, a bright colored scarf, whatever you need. To open people's doors that isn't necessarily like a hello, hi, are you hiring? Right? But like a, hey, that's a really cool hat. I've never seen that before. Where'd you get that? Then you get to sort of make that entry in a non-professional way that can then open the rest of those doors.
And I will definitely co-sign that. Every compliment I give, I completely mean it, but it's a great way to open the door. Hi, compliment, love this, let's keep going. Because it definitely helps ease into the conversation. And going back a little bit, another question we have from the audience here is public health is very broad. We've established that. You've all talked to your concentrations, but how were you able to focus in on what you wanted to work in public health? A couple people sharing about that as well.
Okay, I'll try to go quickly. So, I'm a little kid, probably a little weird, heard about Rwanda, Doctors Without Borders, decided to work for them, spent the next 20 years getting there. Did that, then I was like, oh, now what? Figured out, I've always been pretty good at math and I like math and I'm very introverted, so I really like doing math by myself. What could I possibly do? Epidemiology. Psychiatric epidemiology. So I basically just Googled a lot of things until I found a field that I was interested in, which I think is important if you are not, I wasn't exposed to public health or public health careers when I was growing up. So, this was all a journey that I figured out on my own. And then from there, it was like, well, now what do I want to do? And being really hyper-focused about like, what do I want to do? What do I want to bring? What are the skills that I have? What are my strengths? And how can I use that to make things better? And then right now I'm at a phase of my career where I'm like, well, what are the gaps that are not being filled? And how do I dedicate all of my time and energy and resources to doing that? Because that's where I am. That's my summary.
Thanks for sharing that. Anyone else would like to share how they were able to focus in on what they want? I think you hinted a little bit at it, Jenica, around you just feel authentic to what you're doing. You stand your ground in it. Anyone else would like to comment about this question here?
Yeah, I can go into this. To be honest, I think even in public health, I still am also like figuring out like where I fit and where I belong. So I think it's perfectly fine to know that, like even though you're doing a specific section of public health, again, the universe might give you like a 180 in a different direction. So I think for me, my first ever job was actually working as an HIV/AIDS peer educator. And so the funny thing is, that work involved giving out safer sex kits to random strangers in New York City. So I was basically giving out like condoms and dental dams. And so I think that definitely was like my foray into public health. But eventually I did a bit of like research, and I think eventually I found out that health policy is something that I was more aligned with because I was very interested in kind of like systemic policy changes because I knew that policy change was something that was more important in terms of sustainable change and making sure that, the easy choice is, the best and healthy choice. And so now I've been able to kind of like finagle my way into like policy work. But I think the various roles in public health does involve like kind of like policy and systems change work. So I think having kind of like being able to know how like policy works and how we're able to like change either like legislation or kind of like policy landscape is very helpful. And so yes, I think that's something I'm very interested in, and I think I can definitely tell folks who, that's something that's up their alley. They should also look into like public health policy work as well.
Well, I thank you for sharing that. And I also thank you for highlighting the fact that where you may start in public health may not be where you go next or end up, and that's okay. Change is totally possible. I want to take the time and really thank all of you today for coming and sharing your gems of wisdom. You all are here and sharing it out so that way we all can be better and continue to build upon each other. As we've said many times, public health is collaborative. You don't want to be the one not doing your part. So if we all do our part, I think we definitely have a very, very bright future in public health. I want to reiterate here that this event is being recorded and it will be posted on the event page. I encourage you all to learn more about our 40 Under 40 honorees, including these 4 phenomenal people who have joined us today by visiting 40 Under 40. Nominations are also open for the next class and cohort. And I want to really touch on the fact of what everyone has said here. There are so many mentors. There are so many people doing really great work. Take the opportunity to get to know them. Take the opportunity to nominate them and recognize them. It's a really, really great time to be in public health. We have a spotlight on us and we have a lot of work to do. Once again, I want to thank ASPPH for hosting this with us today. And I want to thank our panelists for sharing and being a part of this and being so transparent in their journeys to public health. And so thank you all so much. Have a wonderful rest of your day and enjoy the rest of National Public Health Week.